Dr. Kevin Kavanagh. Dr. K is a retired physician from Somerset, Kentucky. Also, he started an organization called Healthwatch USA a number of years ago. And good morning, Doc.
Good morning, Jack.
How long has it been since you started Healthwatch USA, and how's it going?
Well, it's been over a decade, and right now it is going very, very well. I've been very pleased with how the organization's grown, and we've especially grown during the pandemic. And as you know, we're having just a dynamite webinar on September 14th. Really top-notch speakers, including Dr. Deborah Birx, along with a number of really nationally and worldwide renowned individuals and experts on COVID-19 and infections. And you can learn more about this by going to healthconference.org.
That was a great get. That's terrific. I had a question that came up over the weekend, and I said, well, I'm going to talk to Dr. Kavanagh tomorrow. I'll ask him. You talk a lot about long COVID, people who have COVID, and then the symptoms remain for a long, long time. If you have long COVID, are you contagious?
Usually not. No. If you do have an active infection, it's extremely low level and pretty much just remains inside your body. You're not shedding viruses. And I don't think there's been any reports of someone with long COVID who is contagious. Now, you need to remember that sometimes you'll get added symptoms a month, 2, 3 months later, and it's really not long COVID, but what you're getting is a reinfection. Unfortunately, with this BA.5 variant, currently, what's being reported on the media is about 25% of all the infections are actually reinfections. And that, unfortunately, the immunity which one acquired from an infection of Omicron or the BA.1 variant is not very good for fighting this BA.5 variant. So I suspect we'll be seeing a lot more infections, which equates with more long COVID. And as you know, in Kentucky, hospitalizations and ICU admissions are increasing.
Yeah, it seems like I'm hearing about more and more people that I know getting COVID than even back at the height of the pandemic last year or year before. I've known a whole bunch of people that have it, and that's just not my imagination. There are the positivity rate's 16.92. That's really high, isn't it?
Well, it is very high, but it's not only the positivity rate, but this variant, BA.5, is the most infectious variant that we've had so far. And many people feel that this is the most infectious pathogen that mankind has ever encountered. It's even more infectious than measles. So one needs to take precautions because remember, you can get in the hospital. You can also develop long COVID. And people need to, in their mind, try to separate out the narrative of, what the chances are of getting extremely sick if you get an infection versus what the chances are of getting extremely sick if you go and do some sort of an activity. And the latter is not only dependent upon how severe the virus is when you get infected, but also whether or not you get infected. So as infectivity goes up, the dangers of this virus go up. And unfortunately, as we have seen, herd immunity is not possible because immunity wanes and new variants arise. And so we really do need to change the way that we live. During the times of high viral spiking, some precautions of wearing an N95 mask, and above all, get vaccinated. That's an easy way of boosting your immunity, which will give you some protection, especially against the severe disease, which results in hospitalizations and even death.
In Kentucky, for example, last Monday, positivity rate 16.92. From mid-April, hospitalization occupancy was up from 166 to 483 last week, and ICU up 20 to 72. Kentucky actually is one of the worst in the country. Is that correct?
That's correct, and that's from state data. And these metrics have been slowly worsening as time has gone on. And recently, within the last 1 or 2 weeks, they've become much worse and much more severe as far as hospitalizations and ICU admissions. It will be very interesting to see what the data is out today. Unfortunately, our data from the state for Monday morning is always a week old. But if indeed we see this progression where we are getting worse and worse results, we really do need to do something different. And that means wearing N95 masks. When you can, do curbside pickup, order online, and avoid indoor public settings. And of course, get fully boosted. The difference in death rates during Omicron between those that have been fully boosted and even 3 doses of the vaccine, so 4 doses versus 3 doses of the vaccine, there's a 4-fold difference in the rate of deaths. And if you were unvaccinated, that jumped to over 40 times difference in the rate of deaths.
I've got a couple of texts I wanted to share with you. One says, could you ask the doctor where COVID was originated from and why we don't talk about the source of the original infection? Wouldn't it make sense to find out where it started to help get information on how to end it?
Well, I definitely think that narrative and discussion and even an investigation needs to take place. Most people have bought into the narrative that, well, this happened at an animal market or just naturally jumped from animal to people. But a lot of people now are thinking that this may have been a lab accident or the virus was released accidentally. I don't think anybody thinks it was released on purpose. And one of the biggest items that makes you think that this is what's happened is that this virus was ready from the get-go to infect people. Usually when it jumps from animal to man, it's not that infectious with mankind. We're seeing that with the bird flu. It'll now and then jump to people, but it doesn't really spread. God forbid if it mutates where it can. But this virus started spreading immediately. And that's really raised the suspicions of people. And so, yes, it may well have come from a lab. We just don't know. But as far as whether or not you should wear an N95 mask today, if you have to go in and pick up groceries, the answer to the latter is going to be yes, wear that N95 mask.
All right, here's another one. This individual's not all that impressed with the vaccines. Says it amazes me that they're still pushing these vaccines so hard when it's been proven they don't do what they're supposed to do. It's only boosting the bottom line of the pharmaceutical companies. How do you answer that?
Well, that's not correct. If you go to the CDC vaccination page and look at the graphs, it is phenomenal. The difference in, for example, deaths between those that are vaccinated and those that aren't. There's a 42 times difference. Now, unfortunately, with the BA.5, they're probably not going to be as effective as that because this is even more resistant to our immunity. And that's the same with natural infection. But vaccines are kind of a way of boosting your immunity because you can get them multiple times and they're safe so that if you boost your immunity, you will, for at least weeks or months, blunt your exposure to this variant. And yes, there are rare cases of severe illness from vaccines, but they're exceedingly rare compared to the commonality of severe illness with the virus. So vaccines are a good way of adding to protection or boosting your immunity. And vaccines have been used for centuries, going back to cowpox. I mean, it's just unbelievable that people are so resistant. And I think that's not going to do well for our society as a whole because we're seeing this vaccine resistance spill over to other types of diseases.
All right, we're out of time, but I appreciate it. Thank you, Dr. K.
All right. Thank you, Jack.